Have you noticed that climbing stairs feels harder than it used to? Your arms or legs tire faster than before. Or even simple daily tasks like carrying groceries or getting out of a chair leave you feeling exhausted. If you're over 50, doctors are noticing a pattern, and it's not just getting older. There's one vitamin deficiency that many people over 50 silently struggle with, and it can be the hidden culprit behind weakness, fatigue, and loss of strength. Today, we're going to uncover what this vitamin is, why it's so critical after 50, and how addressing it can completely transform your energy and vitality. As we age, our bodies don't absorb nutrients as efficiently as they once did. Digestion slows down, medications interfere with absorption, and lifestyle changes can leave gaps in our nutrition. For years, people have blamed muscle weakness and fatigue on normal aging, but science is now showing that a simple deficiency could be playing a major role. This isn't about laziness, lack of exercise, or just getting old. It's about a nutrient your body needs to keep muscles strong, nerves firing, and energy levels high. The vitamin doctors are pointing to more and more in patients over 50 is vitamin B12. It's a powerhouse nutrient that often goes under the radar. Vitamin B12 is essential for your nerve health, red blood cell production, and DNA synthesis. Without enough B12, your nerves can't send signals efficiently. Your muscles can't contract properly, and your body struggles to produce enough energy at the cellular level. That's why people with a B12 deficiency often report weakness, tingling in their hands or feet, balance problems, and fatigue that no amount of rest seems to fix. What makes B12 deficiency tricky is that its symptoms appear gradually. You might notice that you feel weaker after simple exercises, that walking or standing for long periods tires you out quickly, or that your memory and focus aren't as sharp as they used to be. Many people brush these off as normal aging, but in reality, low B12 can silently chip away at your energy and strength over years. In fact, some studies show that a significant percentage of adults over 50 have lower than optimal B12 levels without realizing it. B12 deficiency also affects your blood. It's essential for making red blood cells, which carry oxygen to your muscles and organs. When levels are low, your body can't deliver enough oxygen efficiently, and the result is fatigue and generalized weakness. You may feel exhausted after minor activity, struggle with everyday tasks, or notice that your muscles just don't respond the way they used to. For many, this is the hidden reason why strength seems to decline after 50. The problem is compounded because absorption decreases with age. Stomach acid and digestive enzymes, which help release B12 from food, decline naturally after 50. Certain medications like those for acid reflux or diabetes can also interfere with absorption. That means even if you eat plenty of B12-rich foods, your body might not be able to use it effectively. And here's the subtle part. Deficiency doesn't just make you weak physically. It can also affect your mental sharpness, balance, and mood. You might feel foggy, more forgetful, or even a little anxious or irritable. This combination of physical weakness and mental changes is why doctors now urge adults over 50 to be more aware of their B12 levels. In simple terms, vitamin B12 is like the fuel and wiring for your body. Muscles need it to perform, nerves need it to communicate, and blood needs it to deliver oxygen. Without it, your strength slowly fades, your stamina drops, and even your daily life starts to feel more exhausting. But the good news is that B12 deficiency is treatable, and once corrected, people often notice energy returning, muscles feeling stronger, and overall vitality improving. Now that we understand why B12 is so important, it's also critical to recognize the subtle early signs of deficiency. Some of these symptoms are easy to miss: tingling or numbness in hands and feet, trouble walking steadily, unexplained fatigue, shortness of breath, pale skin, or even mild memory lapses. Often, family members notice changes before the person experiencing them realizes something is off. Catching B12 deficiency early can prevent long-term nerve damage, restore strength, and dramatically improve quality of life. Once we understand how critical vitamin B12 is, the next question becomes, how exactly does a deficiency make you feel weak, tired, or less capable after 50? The answer lies in the way B12 works inside your body. B12 is essential for your nervous system. Every movement you make, from standing up, walking, lifting an object, to even typing or gripping something, relies on nerves sending signals to your muscles. When B12 levels are low, these signals get slower or disrupted, which is why simple movements can suddenly feel more strenuous. Muscles that were once responsive may feel heavy, shaky, or uncoordinated. Another crucial role of B12 is in red blood cell production. Red blood cells are your body's oxygen carriers, and muscles need oxygen to generate energy. Low B12 means fewer red blood cells, which translates into less oxygen reaching your muscles. That's why even light activity like walking round the house, gardening, or climbing a few stairs can leave you unusually fatigued. It's not just about being out of shape. It's a biological shortage of the energy your muscles need to function. B12 deficiency also affects your balance and stability. Many people over 50 start noticing that they feel off balance or unsteady when walking, which increases the risk of falls. That tingling or numbness in your hands or feet, known as peripheral neuropathy, is often the first clue. At first, it may be milder, slight pins and needles, sensation, or occasional weakness. But over time it can progress, making walking, climbing stairs, or even standing up from a chair more difficult. This is why doctors pay close attention to nerve symptoms in older adults. Mental and cognitive effects are just as significant. B12 is crucial for brain function, and a deficiency can lead to memory lapses, slower thinking, and difficulty concentrating. For many, these changes are subtle, at first misplacing items, forgetting a word mid-sentence, or feeling mentally foggy after a long day. Over time, if left untreated, these symptoms can worsen and combine with physical weakness, creating a sense of overall decline that can feel discouraging and confusing. Another hidden effect is mood changes. People with low B12 often report irritability, anxiety, or low mood. These emotional shifts are connected to the brain's chemistry, which relies on B12 to produce neurotransmitters that regulate mood and energy. So, when B12 is low, your body and brain both feel depleted. The tricky part is that many people over 50 experience B12 deficiency without realizing it. Even with a decent diet that includes meat, eggs, and dairy, absorption can be limited. Conditions like atrophic gastritis, digestive issues, and medications such as proton pump inhibitors or metformin can interfere with B12 uptake. This is why routine testing after 50 is so important, because symptoms can be subtle, slow developing, and easily attributed to just getting older. So how do you know if this deficiency is affecting you? Look for signs like persistent fatigue despite adequate sleep, weakness in your arms or legs, tingling or numbness, pale or yellowish skin, shortness of breath during light activity, balance issues, and subtle memory or mood changes. If several of these appear together, it's worth speaking to a doctor and getting your B12 levels checked. Correcting a deficiency is surprisingly effective. Doctors can recommend B12 injections, oral supplements, or high-dose sublingual tablets depending on the severity. Many people notice improvements within weeks. Energy levels rise. Strength returns, tingling decreases, and even mental clarity improves. In other words, B12 isn't just a vitamin, it's a key that unlocks your body's ability to function fully after 50. Beyond supplementation, a B12-rich diet helps maintain strong levels. Foods like fish, meat, poultry, eggs, and dairy are excellent sources. For vegetarians or vegans, fortified foods or supplements are essential, because plant-based diets typically don't provide enough bioavailable B12. Pairing this with regular physical activity like walking, resistance training, or light strength exercises helps muscles rebuild and strengthens nerves, amplifying the benefits of restoring B12. Now that we've explored how a vitamin B12 deficiency can silently weaken your body after 50, let's focus on what you can do to regain strength, energy, and vitality. Correcting this deficiency isn't just about taking a supplement, it's about creating a lifestyle and nutrition plan that supports your muscles, nerves, and overall health so you feel stronger in your daily life. The first step is awareness. Pay close attention to your body. Persistent fatigue, muscle weakness, tingling in your hands or feet, balance issues, pale or yellowish skin, shortness of breath during light activity, or subtle memory lapses are all red flags. These are signals that your body is asking for help. Ignoring them only allows the deficiency to progress, making it harder to restore strength later. Early recognition is the key to reversing the effects before they become more serious. Next comes testing. A simple blood test can measure your B12 levels and show if supplementation is necessary. Doctors often check levels alongside other indicators like homocysteine or methylmalonic acid, which rise when B12 is low. Knowing your levels gives you a clear picture of what your body needs and allows for a personalized approach rather than guessing or self-supplementing without guidance. Once deficiency is confirmed, supplementation can be looked. Options include B12 injections, which are absorbed directly into the bloodstream, or high-dose oral or sublingual tablets for those who prefer a non-invasive method. The results are often noticeable within a few weeks. Energy returns, muscle strength improves, tingling decreases, and mental clarity sharpens. Many people are surprised at how quickly they feel stronger and more capable in everyday tasks they had been struggling with. Diet also plays a critical role. Foods rich in B12 like fish, poultry, meat, eggs, and dairy help maintain optimal levels. For vegetarians or vegans, fortified plant-based foods and reliable supplements are essential. But it's not just about eating more. It's about absorption. Exercise is another crucial piece. Once B12 levels improve, your muscles and nerves are ready to respond again. Incorporating regular strength training, resistance exercises, or even simple daily walks helps rebuild muscle strength and coordination. This combination of proper nutrition and physical activity reinforces the gains from correcting B12 deficiency, making movement feel easier, smoother, and more natural. Lifestyle habits matter, too. Adequate sleep supports energy and nerve function. Stress management through meditation, gentle yoga, or deep breathing reduces inflammation and supports recovery. Staying socially engaged and mentally active also benefits brain function, helping keep the nervous system sharp. Essentially, you're creating an environment where your body can absorb nutrients, rebuild muscle, and restore energy efficiently.